issue with the rhomboid, then it's close to the where it attached onto, like, or like with the belly area, right? So you're gonna check with your patient with the palpation, and then you're gonna working on there, right? So another thing that you can do for this one is like you can do some joint mobilization for the scapular area, right? Because that's where it attaches onto. So you can do the distraction for that one to lift up. So sometimes the body is too big, then it's gonna be hard for you to do it. But the key is that like small fingers here, it's gonna be helping for me to lift up with the humeral head together. Not if I holding like only the inferior angle and superior angle of it and lifting up, it's a bit hard. But like this finger is helping me to lift it up a little bit like this way, right? If I show it here, I should use the other hand too. Like this finger should hold the superior, but like I usually do like the other side, right? And then this finger should be helpful like this one. So you can have better, and then try to go for the medial glide of the scapula, right? So you can do that. And then for the serratus anterior muscle, like that's the technique that I told you that usually you can use this one for the frozen shoulder too, because the subscapularis muscle is the major one that affected, right? So then it's hard to actually go underneath of their armpit and then working on it. So then indirectly you can massage this muscle as well as the serratus anterior muscle too, because it's attached onto the medial border, but it comes underneath of the scapula and attached onto it, right? So you can have your patient arm at the side, and then my hand is gonna be holding their scapula. So usually their scapula sits, like inferior angle sits in between here, and then these fingers three finger hold the spine of the scapula, and this one is more the medial border of the scapula, right? So when I putting my hand here, and I'm gonna have the scapula into the medial glide like that way, and there's a bit of the compression to the scapula, right? And then this hand is bit of the distraction. So when I try to move this scapula, it doesn't cram in the GH joint, right? This one is just accessory, like assist the motion. So go into the medial glide, compress, and massage. Like this way, right? So that's the way that you can working on the serratus anterior muscle, because like this side is gonna be okay. When you are working on the side of the serratus anterior muscle with the strain, so then you need to working on the muscle, right? So then you gotta be careful to placing where you are placing your hand. It's where it attaches onto from their rib. So like coming all the way from here to here, right? So you have to touch this side, but with the consent, right? And like if your patient has a large breast tissue, then I wouldn't go from the opposite side because it's too dangerous. I have to see the tissue. So then I can go to this side to working on like sideways like that way. But if it's like a small size and then the guys, then you guys can go from the opposite side to working on those muscles, right? And you feel like you have too limited access to the muscle, so then indirect massage is gonna be okay to perform, right?